Hello and welcome to week 3 of level 3 Health and Social Care, unit 301. This week we're looking at the roles of regulating and professional bodies, and we're focusing on task 2 of the assignment. So the learning objectives that we're going to really focus on, the 2 criteria, explain the roles of regulatory bodies that inspect health and social care provision, and explain the roles of professional bodies in regulating professions. Now, these are 2 different things, and we must try not to mix them up. I've tried to give you some pointers in the slides about which groups relate to which criteria. So we're focusing on professional bodies. These are groups who work for people who are professionally qualified, and their job is to regulate and oversee them, to sort of manage them really, and to make sure they meet the standards of their work. There are also regulatory bodies. These are bodies that are created by the government, by legislation, to inspect the standards of the overall provision of care. Okay, so not about individual nurses or doctors or physiotherapists, but there are groups that's job is to inspect the overall quality of care on behalf really of the general public. Okay, we'll get into that in a little bit more detail as we go along. First of all, we're going to talk about the Professional Standards Authority, and they are an overarching group that stands between the 2 groups that we're about to talk about and top government itself. They're sort of another layer in the middle, which can be a bit confusing. And to be honest, in the UK, a lot of ordinary people don't really, are not aware of the Professional Standards Authority. They're aware of the regulatory bodies such as CQC, and they're also aware of the sort of professional bodies, say like for the nurses, the Nursing and Midwifery Council, or the Association for Doctors. But people tend to know about them, but the Professional Standards Authority they don't know about, and they're a group that stands above all these regulators, and they monitor the actual regulators. So the bodies we're going to go on to talk about, um, to answer your 2 criteria, this is a group that monitors all of them. So if you do want to mention them, you can mention them in a line, but really they're not, the Professional Standards Authority is not answering the 2.1 and 2.2 questions. So just be aware of that. These are the guys that monitor their behaviour and just report directly to central government. And their job is to protect the public by improving the regulation and registration of people who work in health and social care. So they review the regulators, such as CQC. They review what they do, make sure they do it to a proper standard. And they also review the organisations that register, as I said, the Nursing and Midwifery Council, Social Work England, and the doctors' organisations, various other people like that. And they make sure also that they're managing and registering people properly, keep meeting their standards. So they are a sort of a middleman, if you expect, that works directly to the government, and they give policy advice as well to government ministers, and they encourage what types of research should be done to improve the regulation or support the regulators. Okay, so they apply the principles of right touch regulation. You can look into that if you want. It's a delicate approach where they go in and they observe things and they might just have a look at documentation, and they might talk to individuals to see how cases have been handled. They might come in where, say, some disciplinary action has been taken, say, on a misbehaving nurse, and disciplinary action has been taken. They might review that just to see that the disciplinary action process has met the appropriate standards and that the decision was appropriate. And they do have the ability to overturn decisions as well. So they're a bit like the organisation, say, with the police, that goes in above the police and just makes sure that they follow all their rules properly. In extra reading, there is a PDF to give you an idea of all the different professions which are regulated. So you know a little bit about the regulators that these guys work with. So just remember, they stand above the regulators and the inspectors and the professional bodies, and they just hold them to their own standards. Okay, a little line like that is probably all you'll need in your assignment, because it's much more important that you write about what the other two groups do. You're not sure about this, you all know the way out, just give me a WhatsApp if you want any clarification. So, as I said, the Professional Standards Authority, they oversee all the registered care, and it oversees all the care that's regulated. And they do carry out special reviews, or they can carry out an investigation on behalf of the government. So if the government thinks that maybe one of the organisations isn't working very well, or if the government thinks that things might be failing in a certain area, it would be the Professional Standards Authority that they might call in to do an investigation on their behalf. So here's, if you want to find out a little bit more about the Professional Standards Organisation, there's a link to their website there. And one of the things that they do is they do a little review, say, also of the Health and Care Professions Council. Health and Care Professions Council, if you remember, is the group for all those professions that are not professionally qualified, such as nurses, doctors, dentists, etc., but for these other related professions, including care workers, including yourselves, and technicians, physios, occupational therapists. They will all come under that health and care professions, art therapists, psychologists, and they do the same sort of role for them. And they will just review the performance of that, and then they'll every year, I think they'll do it every year really, and they'll give a report to Parliament to see where things are being managed well, where they're not being managed well. And all the final fitness to practice across, that would be across nursing, medical and health and care professions, they will review every decision, just in case, as I said, in case they think the procedures haven't been followed or that the decision isn't clearly documented. It's all about procedure, really. What I have done in extra reading is I've given you a little bit of a document with an example of one of their practice reviews. Okay, so remember, they're not the guys who do the actual investigation, fitness to practice. That would be the appropriate professional organisation. So, say if it's a nurse, it would be the Nursing and Midwifery Council. They will go through all their processes right to the end, and then if they decide, say, to suspend or to strike off a nurse because of his or her behaviour, they will have appeals processes and all this, and they'll go through it. Right at the end, a review will can be carried out by professional standards, and they will just make sure that all the procedures have been followed properly. It's just a secondary. This was produced for years. There was nobody in between. Once the Nursing and Midwifery Council have made a decision, they've made it. Now there's this extra level. I mean, it's debatable how valuable it is. The only way you'd know that is by finding out how many decisions they overturn or not, really. So that's something you might want to have a look at the research on if you're interested. As I said, in extra reading, there's a fact sheet. It get with like a little case study of a professional decision that they've reviewed and challenged, just so you get an idea of the sort of thing they do. So now we're going to start thinking about professional bodies who regulate, okay? And this is 2.2, criteria 2.2. I've brought the criteria into all the relevant slides to try not to confuse you, because in previous assignments, other groups of students have sometimes mixed these two up. So hopefully I can help you with that. So here's an example of a professional body. As I said, the Health and Care Professions Council. They regulate health, psychological and care professionals in the United Kingdom. And these are usually people who are not sort of qualified as nurses. They tend to have their own one, but it'll be all the therapists, dietitians, other sort of technicians, radiographers, people like that, as well as care workers, people who have their level threes. So what do? They set standards for the professionals' education, training and practice. They approve programs at which the professionals have to complete to register. So they say there are certain steps you have to take, and once you've done that, you're of a good enough standard to register. They also keep the register for all the people who meet their standards. So that is like a live register. And if someone is thinking of employing someone, they can check with those registers to make sure there's no problems and that they've got no marks against them or no warnings or no criteria. Okay. And they also have the role of taking actions if the professionals don't meet their standards. And the actions can be, either suspension from the register usually, or being struck off the register if behaviour is bad enough. If you are not on the registers, it will be very hard for you to work. If you are not on the nursing or medical registers, you can't work at all. So each profession tends to renew at a set time. So like it might be all the operating theatre technicians might review in February. All the art therapists renew in the summer. That's how they work it out, so they can deal with it. All registrants have to do a little professional declaration to say that they've kept up with their CPD, remember, continuous professional development. So, and that they've worked so many hours, and then they will pay a renewal fee. So every year they will pay a fee to remain on the register. And by making that declaration, excuse me, they've confirmed that they've continued to practice. You're also, when you sign your declaration, you confirm that you've continued to meet the standards and that your practice is still of the appropriate standard. There's not been any change in your character. You haven't been convicted of anything heinous. There is no massive change in your health, which might affect your ability to practice safely. So lots of things to think about, really. And as said before, you've continued to carry on doing CPD. And you need to be able to evidence any of these things that you've said you can do. They might want you to come back, I don't know, depending on what you do. Do you need an eye test as you're getting older? If you've got a sort of long-term chronic disease, is it being well managed? You might have to show evidence of that. So they'll come back asking for the evidence that they want to see. Another professional body who regulate is the Nursing and Midwifery Council, as I said, probably one of the most well-known one. It's the regulator of pretty much all nursing and midwife professionals. When this was written, it was 732,000. That was just in the UK. Well, it might be England and Wales, actually. And their main role is to regulate, also to promote education within the nursing profession, and to promote their standards. They also maintain a register in exactly the same way as the previous organisation does, to identify who people are eligible to practice. Again, if someone's if I was engaging a nurse for my care home, I would have to she would have an individual PIN number that I would check with the NMC and just make sure that her registration was live, was paid up, and had no suspensions on it, things like that. Okay. And the other role is if there are any concerns about their nurses and midwives, then they would investigate them and take action if necessary. So their role is also to support the professions. There is a lot of legal support, because nowadays there's a lot of litigation going around with healthcare professionals. The NMC does have some legal support and guidance and advice available for people who are registered with them. They also create resources, educational resources, updating guidelines. They have a code of conduct which they expect people to work to. But they're always reviewing things like that as well. They they do other types of research which allows them to try and influence what people do in health and social care, and they share from their regulatory activities and from the investigations into individual behaviours. They can actually sort of look at workforce planning as well by giving people an overall idea of where, if a lot of nurses come a cropper in a certain area, and then they sort of look into that and sort of work with the government to see what you could do and what is the problem. As I said, they produce a code of conduct. A code of conduct has four main themes, which prioritises people, to practice effectively, to preserve safety, and to promote professionalism. And then there's a set of statements. You can look up the code of conduct. Fitness to practice is an important thing again for the NMC. All of these professional bodies pretty much do the same sort of thing. You're probably aware of that. So you might just want to pick two of them to give an example of 2.2. Okay. They look to the nurse's behaviour against the code. And if there is an allegation, often from an employer, could be from a member of the public, they will investigate someone against their behaviour to the code. And they will be looking at three areas. Does the person meet their standards for skill? Does they meet their standards for up-to-date education? Remember your CPD. And do they meet the standards for professional behaviour? Okay, and that's more about people's personal behaviour, personal attitudes, personal approaches. Two types of actions they may take is suspending someone for a set period of time, or permanently. If it's a serious enough offence, it will be permanently, and they'll be struck off. Quite hard to get back on again if you get struck off. I don't know of anyone who's ever done it. There could be other issues though, and they could identify that there's a health issue stopping people performing properly, and if so, they may suspend someone for a while, but give them support in getting the health issue sort of managed. So they're not completely unreasonable, but it is important for people to be aware that they're there to protect the public from incorrect behaviour from nurses. So if you fail, then they will give you some time, and that's why very often they will suspend people, enable them to get things sorted out. Depends really how serious it is. So if you want to raise a concern, they have a specific area on the NMC website called Concerns, Complaints and Referrals. And they'll investigate all sorts of allegations like misconduct, lack of competence, not having the necessary knowledge of English. Now, this one's had to be added because we had a lot of overseas nurses. Some hospitals got very desperate for staff and started taking on people who weren't really meeting the English requirements, and therefore sometimes there were knock-on problems, sometimes quite serious, you know, resulting in service users um, not being treated as well as they should, or becoming at risk because of misunderstandings and communication problems. So this one was added very much as a more recent issue. Criminal behaviour has always been there. So if you end up caught with a criminal record, that will be referred automatically to the NMC, and they will decide, depending on what the reason of the criminal record is what action they will take. Certain types of criminal behaviour, people will just be struck off immediately. If it's any form of violence or abuse, they tend to be struck off. They have to try very hard to prove that they wouldn't hurt one of their service users. So, and if it's serious ill health, sometimes people don't always tell the truth about their health because they don't want to lose their job. If it's serious ill health, then they will have to decide what to do about that as well. They have that power to basically retire you on ill health grounds. Okay, so that was the NMC. We've talked about HPCP, we've talked about the NMC, and now another example I'm going to give you is Social Work England, also meeting criteria 2.2. So another professional body, and obviously we could probably guess that this is a professional body that covers social workers. The last one covered nurses, this one covers social workers. They do pretty much the same thing, really, almost in the same way, but they just cover a different group of workers. So it's a specialist body that takes an approach to regulating social workers in their roles. And the job is in the same way to protect the public, to enable positive change, and to, ultimately improve by keeping the standards high to improve the lives of the people that social workers are working with. Um, this is Social Work England. There are different in the UK. There are some different regulating groups for Wales and Scotland. So this one is just in England, and it's really to also give the social workers some additional support as well whenever they need it. Social Work England has not been around as long as the NMC. They came out of the Children and Social Work Act 2017, and then the Social Workers Regulations 2018. They brought it together and decided that they needed something to regulate and set more standards. So the nurses are always a bit further ahead of the social workers, in this professional oversight. Rules and standards, again, same sort of thing as the NMC. They have a set of standards. You can look them up online if you go to the Social Work England website. They've also got professional educational training standards so that people need to know if they want to become a social worker, exactly what level of training they have to get, where they have to get it from, and what CPD they need to do and what's expected of them. And they've also created a set of rules and what can be expected about them, about registering people and fitness to practice as well. And again, it's very, very similar to the Nursing and Midwifery Council. Okay, so those two were examples of professional bodies that regulate the profession. So you could give me a couple of lines on Social Work England. You could just identify more than one. Okay. Um, the question only asks you to identify the professional bodies, but you can name both of them and then you can just give me a summary, because pretty much the professional bodies, they do pretty much the same sort of thing. They have their standards, they inspect, they do fitness to practice. People have to pay to register and then they have to renew their registration. They have to show CPD. Okay. No difference between any of them. So all you do is need to do a bit of a summary of that role, and then you can identify at least, give me at least two names. So Nursing and Midwifery Council, Social Work England will be fine. Now we're moving on to 2.1, which are the regulatory bodies that inspect. So the professional bodies deal with the individuals, nurses, technicians, depending on, you know, what your professional skill is. You have your own regulatory body. They're there to see that you as an individual meet the standards. Now we're going to look at the regulatory bodies that inspect, and they are really looking at you as an organization and the people who provide the service. So they will be inspecting. So those of you who are working in care homes, they will be inspecting your care home. So it's the care home organisation that will be inspected. Although along the way they will comment on maybe some individual, you know, because they do interview staff, and they may comment on some of the individual skills that they come across. It's really, they have an overview on how people perform, and it's, again, it's for a similar reason, but it's from a slightly different angle. So we know there is legislation that you have to perform against if you deliver care, be it in a care home, be it in a hospital, be it in the community. But we need to talk about the people who regulate that. So one of the most well-known people is CQC. They are the independent regulator for quality and safety of care. And that includes all care provided by the NHS, be it hospital, community, or in care homes, because some NHS do run some care homes as well, or some rehab care, or some intermediate care. Anything run by local authorities, because they used to run a lot of care homes themselves. They tend to run less now. They tend to have contracted them out, but they still have responsibility for them. Any independent providers are independent organisations or voluntary organisations like Age Concern, Age UK. They're the sort of people, MenCat run homes for people with learning disability. But have a think about the country that you live and work in. There might be a lot of private providers, there might be some charitable providers there. Even so, they would all be regulated by the CQC if they were in the UK. And you would have, in your own home country, you will have some sort of regulator in that. I can't say which one, because people can be, I could be talking to people from all different countries here. Okay, so they register most types of care. They regulate providers of healthcare services to people of all ages, not just hospitals, not just clinics, community services, mental health services, but also, don't forget, dentists and GPs. Okay, and that would include private clinics. So if you're going to go and, you know, have your nose done, they would regulate a private clinic. If you're going in for some maternity services, you might go for a private maternity clinic for that. They would register them as well, and they will regulate and inspect all of these clinics. So it's not just the NHS, it's the private stuff as well. Okay. So CQC, Registered Care Services under the Health and Social Care Act 2008 and all the relevant regulations. And these are the sorts of things you see when you get inspected by CQC if you're working in the UK. You will see that the inspection report really relates to the regulations of that act. So they're inspecting you against that act. And there will be reports of incidents, information from people who use the services. They might interview friends and family. They might interview other professionals who are arm's length from the service, and they do quite a big inspection. They talk to the service users, they talk to the staff, and then they come together with a judgment. Now, there used to be a sort of set frequency to how often it was done. Used to be annually, but as there was more and more work, it became a bit more differently organised. So it depends. If someone is maybe a not such a well performing service, they might be investigated, reviewed more frequently, and the better performing services may be reviewed less frequently. They have a wide range of enforcement powers they can use. So if they find care services are not meeting standards, they can prosecute, they can impose financial penalties, they can fine people, and they can get improvements done. They can force improvements to happen under the Health and Social Care Act. Eventually, if a service doesn't comply with all the work and the workforce plans that they give them, they do have the power to close the service if it's a completely failing service. But they are expected to sort of, do whatever they can to help a service improve beforehand. So that's CQC, the most well-known regulatory body and the one that you probably have the most interest in and the one it's worth you writing about. Okay. Another body that inspects, so that meets criteria 2.1, is the Medicines Healthcare Products Regulatory Agency. Much smaller, much less powerful, really, focuses very much on medicines and medical devices to make sure that everything is safe. It's responsible for the regulating of medicines and medical devices and investigating any harmful incidents. They also look after blood and blood products, and they work with the UK Blood Services and other healthcare providers that give blood or manage blood. There was an incident years ago in the UK where a whole load of blood was bought from the States, which was contaminated with HIV, in fact. And it was the MHRA who had to go in, because there was some issues and this blood transfusion services were using this blood and they had to go in and do a major investigation, and that was all over the country and it was a real problem, and it's still being resolved about 13 years later, so it's a big, probably more than that actually, big issue. So sort of medical devices, it might be a breast screening clinic, so they are responsible for doing an inspection every now and then to make sure that all the breast screening equipment is up to date, standard, in good nick, well looked after, and that the staff know how to use it properly. So that's a sort of very focused investigation. They might also work through community pharmacists, getting them to go into care homes to have a check about all the medication and how it's managed, how it's used. They might just do a one-off afternoon check in your care home to see that everything's put away properly, or the things are signed for in the legal way, those sorts of things. So they will do that, and they will give reports They will report back to the organisation, but they go direct to the Department of Health with any concerns as well. And the powers of pressure will come from the Department of Health, really. So if you're not managing your stuff properly, you will hear about it, and again, you will be expected to make the changes. The third one, who is really quite important, is the Health and Safety Executive. They are a regulatory body that can inspect. Now, they don't do routine inspections. They can be, because they long arm it, they sort of hive it out because of CQC's inspection. CQC will do the health and safety inspection as part of their normal inspection. If they have concerns, or if it's an area that might be a bit technical, they will call the health and safety executive in. So the health and safety executive normally goes out doing factories, offices, shops, things like that. And because of the speciality of healthcare, they've sort of shared it out to CQC. They say they work in partnership. CQC, because they are able to enforce, although there are very strong enforcements for health and safety. So if CQC find major health and safety issues, they will contact health and safety, and they might come in and do a review with them together. And then the enforcement power will drop to health and safety because their enforcement power is even stronger. It's probably one of the strongest enforcement powers across the country, the Health and Safety Executive, and no one can argue with them. No one can really stand against them. So they are a national independent regulator. They work with all care settings, private or public, and they pride themselves on treating the NHS just the same as the private organisations. It's all about the people, really, in the same way that when they do factories, it's all about the safety of the people. And remember, the health and safety exec is not just looking at the safety of your service users, they're also looking at the safety of the staff. People are people to them. They don't care what role you've got. Everyone's got to be safe. So if your organisation has got you doing lifting without the proper hoists, which mean that you could be putting yourself physically at risk, when there's very clear instructions telling you when and where you should use a hoist, weight of person, type of lift, etc. If they're notified by CQC about that, they will come in and they will take enforcement action. So if your owner says, well, I'm trying to keep the patients safe, but they're saying, well, you can't do it by making the staff at risk. Okay, so they won't discriminate between staff and patients. The owner or the organisation has to make sure that everybody is equally as safe, and that staff cannot risk their own health for their patients' health. So that's important to know, really. But they can inspect whenever they want. So if they hear someone, they've got a website, and if someone complains that and it could be just a neighbour, say that they've seen what they think is unsafe practice going on in the garden or something like that. They could quite easily just come down and do a random investigation. They will probably ask CQC to do it, but if CQC, if they don't have capacity at the time, and if the health and safety exec have a real concern that this sounds like a real problem, that they can come. They have the right to come. Now, one thing that you will be expected to do as part of your existence in the organisation, you'll be expected to undertake regular health and safety training and updates throughout your career, no matter what organisation you work in. And the health and safety exec will gather information from that just to make sure that people are getting training. Again, normally it would go through CQC. If you were based in the UK, it'd go through CQC. But in other countries, they might not have that same relationship. But you need to be aware of the partnership that health and safety and CQC work together in the UK. So again, for 2.1, these are regulatory bodies that inspect. You just need to give an idea of what they do when they inspect, what are they looking for, what are they thinking about from what I've said. And you can just name a couple, so you can mention health and safety, etc. I would focus, because this is a care this is a care qualification. You need to show me your understanding of CQC. So I'd rather you led with CQC, and then you can just mention health and safety or the medicines agency if you want. Okay, so focus those two on answering 2.1. That's the last slide in this one. As I said, in extra reading, there's just a little bit to show a review of a decision on a member of staff's fitness to practice. You can see how the Professional Standards Authority might come in and review a decision. There's also just a little list of the people, of all the professions who are regulated, so you know who tend to come under professional bodies and are regulated. So most of the lists have to register somewhere in one of the three areas. Okay, so again, if you're unsure, and people have mixed up 2.1 and 2.2, if you are unsure, just come to me on WhatsApp. But otherwise, that's the end of this week's session. Okay, thank you very much. There will be a quiz. You'll find that in extra reading as well, just to consolidate your thinking. Okay, thank you very much, and I'll see you in week 4.